our vaccine status is generally pretty well known, and that there's no real reason for the ABS not to be able to link this up. Now, look, the health departments around the nation were really efficient, and some might say too efficient, at attributing deaths to the virus back during the pandemic. Should they be doing the same thing now with the vaccine status of people who die, especially of young, healthy people who die of natural causes?
Absolutely, absolutely. And that the COVID counting, it was some of the most, this is a word that gets probably thrown around a bit too often, but you'd have to say in the case of New South Wales, as far as I'm concerned, it was corrupt, because the assistant to Kerry Chan came out in a press conference earlier this year when Dominic Perrottet was also at, and it was a big announcement that day that they were going to reduce the number of days of back capturing, from 28 days to 14 days. And she actually went on to say that if you fell off your bike and broke your arm and went to hospital and you had COVID in the prior 28 days, you were counted as a COVID case. So, they were looking for any which way means possible to, call you a COVID case. And we actually had the TGA admit to me on questions on notice from the last set of estimates that the PCR test couldn't distinguish between live and dead virus anyway. So, yet again, it's the fear mongering and the way they've conflated COVID. And look, for the record, I actually do think that there was a virus out there that had a bit more of an edge to it. But it was the reaction to it, the way they used these, imposed vaccines and the lockdowns and everything in the name of a respiratory airborne virus. And humans have been living with respiratory airborne viruses for tens of thousands of years. And look, they can be dangerous, don't get me wrong, and we should obviously treat them seriously. But, if you stratified this virus for risk, it was, you could tell straight away it was older people who were most susceptible to the virus. The average age of death from the virus wasn't much different to the average age of death. It varies between 82 and 84. And I was told very early on by a qualified doctor, you can tell how severe a virus is by the average age of death. And just for comparison, the average age of death of swine flu in 2009 was 48. And Spanish flu, for what it's worth, 28.
Now, just getting back to your conversation with the ABS in that committee last week, you also asked for a list of non-specific causes of deaths this year. This is in relation to, the sudden spike in excess deaths in Australia. Now, the ABS also took that on notice. Now, what are non-specific causes, and what will they reveal when you find out what they are?
Well, that's a good question, Fred. And actually, I'd actually already asked the ABS about May or June this year for the 2021 breakup of non-specific causes. And they were at about 40,000 deaths out of the 172,000 deaths last year. And they jumped off the top of my head, I'm a bit rusty on these figures, by also double digits. But what I wanted to know was were there any so non-specific causes would be things like car accidents, workplace accidents, misadventure, and lots of other things that I don't know. Until I get a line-by-line breakup of those 40,000 deaths, I can't be sure. But what I wanted to see was there anything in there that could have been put down as a health issue, like heart attacks, diabetes, dementia, which, as we know, have all risen